Hey guys, welcome to Root Canal Academy. It is 5 in the morning and I am just recovering from my second vaccination shot with Moderna. And man, that put me out for a day. Definitely felt like I had the flu. But 2 days ago, I treated a case that I wanted to share by video, the entire case. This happened to be my top referring dentist's daughter, so I wanted to take very good care of her, like we do all of our patients, of course. But this one, I wanted to make sure that I took really good care. So I wanted to show you how I followed the Root Canal Playbook in this video, and I used the Pro Taper Gold shaping system, and then I used warm vertical obturation using pulp canal sealer or Kerr sealer. And in this case, this tooth number 20, the diagnosis was pulp necrosis, symptomatic apical periodontitis. The tooth did not respond to endo-ice. She was symptomatic to percussion and bite, and there was a large periapical radiolucency, as you will see. And so she was definitely hurting a little bit. But the case selection on this tooth was simple. It was a simple tooth, and I think all of you can do this if you learn the Root Canal Playbook. Then on the anesthetic, I number up using 3 carpules. I use 2 carps of lidocaine in a mandibular block with the Gaugates technique, 1 carp of septicaine in a buccal infiltration right next to tooth number 20. We placed a rubber dam using a number 1 clamp on number 20, and then we pulled the clamp up to 21 and flossed through the 21, 22 contact. That way I had a nice visualization of tooth 20 when I access. So you'll see this entire video. I hope you enjoy it. You guys have a great day. Check out rootcanalacademy.com, and I wish you all well. Thank you.
All right, we're looking at tooth number 20, and it's a symptomatic apical periodontitis case. You can see the periapical lesion there on the PA. It's a pretty large lesion. Now, this happens to be one of my best referring dentist's daughter-in-law or daughter, I believe. So we need to do a good job. So here it is. You can see that the diagnosis is pulp necrosis, number 20, pulp necrosis, symptomatic apical periodontitis because she was percussion and bite stick sensitive and no response to endo-ice. Let's look at the access. Tooth number 20. Let's start there. And you can see kind of the rubber dam clamp. You can see how I've clamped and rubber dam number 1 clamp with the rubber dam, split rubber dam into 21, 22. I start with the 330 L burr with the water on. An oval access right in the center of the occlusal table, right? This should be one of the easier pulps to locate. So I'm not too concerned, me, you, any of us really, to find this pulp chamber, but I still think we need to take our time. You can see how I just popped in right there. It was pretty quick. So within 30 seconds, I was able to pop into the pulp chamber, and that's always good. That's always a good sign. That's not going to be the case on a lot of upper molars, lower molars, but in this tooth number 20, pretty quick getting in there. Take your time though. You don't have to pop in, and it's not the Indy 500. You don't have to run the race and be there within seconds. You just take your time. Maybe it takes you a couple drilling cycles. Make sure you're centered, that you didn't drift, you didn't do a mesial or distal drift. There it is. I use my Endo Explorer, double checked. I'm into the pulp chamber. It's necrotic. You can see that. Now I'm going to just open it up just a little bit with my 330 L burr. This is just getting a nice open pulp chamber there or area, removing any roof, any overhang. And once you find this canal, it's pretty much game on, as long as you follow the playbook. So I'm using bleach, just kind of rinse out some of the debris. Now let's get into the playbook. Let's follow the playbook. So what do we do next? Okay, well, first we're gonna smooth out that axis a little bit more with the thin diamond, and just to make sure it's nice and smooth. You don't have to do this, but I like to do this sometimes with a thin diamond or an Endo Z burr, and just kind of round the axial walls out so it's nice and smooth, and it just looks pretty. And no, I'm just kidding, but it's open. That you want that pulp chamber open. You want all the overhangs removed. You're going to start using lots of bleach with a side vented needle. If you look closely, you can see the side vented. The bleach is coming out through the side. There's an end cap on this needle. Nice and easy with the bleach. Just rinse out all the crap in there. And look how open that pulp chamber is. Okay, so now we're going to follow the playbook. First, we're going to do a coronal negotiation with a 10C shorty. It's very quick, just to make sure the canal's open. Then we're going to do our coronal flare. All right, this is the Pro Taper Gold SX at 300 RPMs. You're going to brush 4 to 5 times to the outer wall. Now look at that. Look at all the debris. It doesn't sit on the tip. The debris is in the middle part of the flutes. The tip is just a guide. The coronal flare in this case is very quick, very easy. You're just opening the top so it's easier to get to the bottom. Open the coronal part. You're not trying to go down to the apex until you do the coronal flare. Now, I take a 10K 25 millimeter file and I negotiate to patency. Typically, this tooth number 20, it's a pretty simple negotiation of patency. I felt it pop through the framing and it hit my estimated working length that I got before. And then I went ahead and I'm going to take a ProMark Apex locator and I'm getting a working length. I want the file to pop out the framing like a baby being birthed out of the birth canal. The head pops out of the birth canal and this file pops out of the canal into the tissue. And that's what happened. I did it. I got a nice accurate reading. There's my reference point, the buccal cusp. Move the stopper on top of the buccal cusp. That is your reference point forevermore for this case. I'm double checking, making sure it's perfect. Take your time, get a nice working length, nice accurate working length, and then it's game on, folks. This is going to be a piece of cake to complete this case, of course, if you follow the Root Canal Playbook, which I know you always do. So after you do your negotiation of patency, you get an accurate working length. Make sure a 10 file is nice and loose to the apex, to the working length. And it is. It was easy. It was loose. Now I'm going to start shaping, and I'm going to get my glide path all at the same time with my Pro Taper Gold Shaper 1. I kind of cheat a little bit. I don't do a glide path per se. I use this file, Pro Taper Gold S1, to get a glide path. You want to do 4 to 5 engagement, disengagements down the canal, nice and easy, folks. You're an artist. You're not a construction worker. Follow your Zen Indo. Yoga time, baby. Breathe deep, relax. Don't hammer that file. Nice, just brush strokes. Be gentle. Now, once you take the file out, irrigate with bleach and recapitulate, which means just check your patency, make sure there's not debris in there, and then go to Pro Taper Gold Shaper 2. In this case, the Shaper 1 went right down to working length, so it went in one pass. So it's a piece of cake. The Shaper 2 is going right to working length in one pass. You do 4 to 5 engagement, disengagements. So engagement down the canal, let the file cut the canal wall, and then you disengage it after 3 millimeters. You disengage it up 3 millimeters. So it's 4 to 5 engagement, disengagements, get out. In this case, that's all it took. One pass. 4 to 5 engagement, disengagements is one pass, and the S1 and the S2 went right on down. And those shapers will shape the coronal and middle thirds. Now I'm using the finisher 1, the F1, Pro Taper Gold F1. It's got a 20 tip. I'm just starting to finish the apex now, getting that deep apical shape. The F1 went right down. You're going to do a lot of the work with the Shaper 1 and the Shaper 2, and then the F1 and the F2 are going to fly down. In fact, I see this in most of my cases. Most of the work is with the Shaper 1 and Shaper 2 in the Pro Taper Gold series. Always irrigate with bleach and recapitulate every time you take a file out of the tooth, a rotary file. Now I'm going to finish the apex, starting to finish a little bit deeper now with the F2, or not deeper, but a little bit bigger with a 25 tip. You can see the debris collects at the end of the finishing files. More on the shapers, it's more in the middle third of the flutes. On the finishers, you'll see debris collect in the apical third of the flutes. So it went right down to length. Piece of cake. I'm going to irrigate with my 6% bleach, side vented needle. It only goes in about halfway down the canal. Suction it out. Now you recapitulate, which means you just check patency with a number 10 file. And then I'm going to go to the F3 because it's a necrotic case. And the F2 went right down, slid right down. Now the F3, 1, 2, 3, 4, 5. I'm really kind of 6. Try to do 4 to 5 engagement, disengagements, and really clean that apical third, that apex area. That's where you're gonna get success if you clean that apical third. Get out the debris with your bleach and then check your recapitulate with your 10 every time. It's just gonna be part of the playbook. And then look, I'm right into the cone fit. Okay, I got my cone fit rolling. and I'm checked, and I see how I crimped it. I grabbed it at the reference point, the cone. I'm going to check my measurement and make sure that it fits my working length, and it did. So that's perfect. So now what I'm going to do is my cone fit. There's my cone fit. I've got to put a cone fit in there. You can see the cone fit x-rays. Now I come back, I take the cone out of the canal, and I'm going to run the endo activator with the bleach in it. I'm going to run that for a minute to 3 minutes. Now, because it's a single canal, I will probably just run this. I'll run the endo activator for probably 3 minutes because I've finished so fast. And then I may let the bleach soak for a few more minutes. But, you know, in this video, I'm just going to kind of keep rolling through it, just showing you. This is the endo activator. It's sonic activation. Run this through for a minute at least with the bleach, and then suck out all the bleach with a micro vacuum. That was the Endovac macro cannula. And then I'm putting Q-Mix in. Now, Q-Mix is a final irrigation or final disinfectant. It removes the smear layer, okay? Now I'm going to run the endo activator, the sonic activation device with a polymer tip for a minute at least per canal, and then I will suck out all the Q-Mix, and I'll dry with paper points. And when I use the F3, prototypical F3, I'll use extra coarse paper points, or I'll use the F3 paper points. You know, it all comes in a system. So 2 or 3 paper points, you just put paper points in until the apex is dry. It's pretty simple. It might take 1 paper point, may take 2. If you have a micro vacuum like the Endovac macro cannula, then it goes a lot faster. Now I buttered the cone, the apical part of the cone, with Kerr sealer, which is pulp canal sealer, EWT, extended working time. I just butter the apical third. You don't need a ton. And then I placed it to length, and about 3/4 of the way down to length, I lifted up the cone about 2 millimeters, and then I seated it to length, and that just grabs a little more of the sealer on the cone tip. Then I take my Indo Pro 270 heat tip, and I go down I leave a 5 millimeter apical plug of gutta percha. So if my working length's 21, then I'd want to go down to about 16 millimeters. And then I have a Dovkin plugger, and I'm going to go ahead and use this Dovkin plugger to kind of pack the apical third, that apical plug, and kind of pack it down into the foramen, because that 5 millimeter apical plug, the heat will travel down that plug, and you can kind of use the plugger to push that gutta percha down into that foramen and get a nice seal. It'll kind of mold into that irregular foramen and give you a really nice seal. And there it is. I put a little dot of sealer on the Dovkin plugger, that white, the smaller plugger, and there it is right there, a teardrop of sealer, and I just kind of put it against that apical plug just to get a little more sealer on the canal wall. This is just optional. I like to do this because I feel that it just gives you a little extra sealer in there. Then I'm going to backfill it. Use any backfill device you want. I like the Gutta Smart backfill device. The Gutta Smart also has a heat tip. They're cordless. They're excellent. So I use the Gutta Smart heat tip and the backfill. They're great. I use the backfill all the time. Just put the 25 gauge tip onto the top of the apical plug, and then just slowly let the Gutta Smart just push you right out of the canal. And then I'll go all the way up to the orifice. Just backfill gutta percha all the way up to the orifice level, and then use a larger plugger. I'm using the black end, Dovkin black end, and I'm just packing it down. And you can see now I've got a nice fill. Really, it's pretty. It's a pretty cool case because it's pretty simple. And I think that a lot of us can do this case. A lot of dentists can treat a case like this if they just feel more confident and they have the tools, number one, and then number two, you have a playbook. So I want you to follow this root canal playbook. I follow this playbook every case, the hardest cases in the world and the easiest cases in the world. I do the same thing. Now, the hard cases obviously take a lot more time and a little more delicate work and a little more frustration, a little more sweat and tears, but it's the same thing. I follow the playbook. And for the most part, I have incredible success with that playbook. Now, once you're done, because I use pulp canal sealer, you want to use a little chloroform brush with a little bit of chloroform on the end, followed by a little alcohol brush. Okay, if you use like ribbon sealer or AH+, all you need is alcohol, and then you're golden. Okay, and that's it. So it's pretty simple. You want to clean up the pulp chamber, and then you'll place a nice composite core in there, And in this case, I have to place a sponge and calve it. There it is, baby. Post-op is looks pretty good. I mean, you know, and now we got to do a 6-month recall and just make sure everything heals. Okay, thank you so much. I hope you enjoyed this presentation.